2/3 of the public knows little or nothing about lupus. If you have lupus, something goes wrong with your immune system and it attacks healthy cells and tissues, parts of your body in mysterious ways. Here to shed more light on that, Dr. Chitkara. Good morning. Thanks for being with us.
Good morning. It's a pleasure, Brooke.
Tell us why this is so mysterious.
It's because a lot of patients present with many different symptoms. Not everybody reads a textbook and comes in with the same symptoms. It can affect many different organ systems. It can affect the skin, the joints, the heart, lungs, kidneys. And patients can have different periods of flares and remissions. So when they come in to see the doctor, they may not have all the symptoms. And so it's really important to have a good history and physical and also a really good diagnostic test to help diagnose this disease and get patients on the right treatments early on.
And up until now, it's been difficult to diagnose because the standard test was not necessarily catching all of the cases, and it was very difficult for people to understand whether or not they even had the disease. Tell us what's changed with that.
That's correct. So traditionally, the anti-nuclear antibody has been the test that's been done. And that is a very sensitive test, but it's also false positive in about 22 to 40% of patients. So it's really, really important to have a test that's comprehensive and that can capture the disease and also differentiate it from other connective tissue diseases such as rheumatoid arthritis and other things. So the AWISE 2.0, this connective tissue disease test that is marketed by Exagen Labs, which is right here in Vista, is a very comprehensive test that looks at different biomarkers. They have also validated their complement activation products, the CB caps, against other rheumatic conditions, and that not only helps us diagnose, but also gives us an idea about the activity of the lupus patient.
We're looking at that test right here on the screen right now, and such a big deal because this is a national problem, and right here in our own backyards, we're finding a solution to at least diagnosing the problem, right?
That's correct, yes.
Tell us what this means for patients and how this could change their lives.
So it is a very accurate test that we get the results of very soon. It's ordered by doctors. Patients cannot order it by themselves, so they have to see a doctor to help order it. It helps us get the no cure, but gets them on the right treatments and get them in remission and hopefully prevent damage and help them lead a fully active life.
If somebody thinks they may have lupus or thinks a family member may have lupus, what type of doctor should they see? You're a rheumatologist. Is that what they need to do specifically?
That's correct. Well, they would have to go to their primary care doctors who would evaluate them, and if there's a need for them to see a rheumatologist, then they would get the referral.
Okay, this is such a big breakthrough, and again, right here in our own backyards in Vista, and we'll talk with you a little bit more about that coming up at 10 o'clock tonight on our live broadcast again. If you would like to reach Dr. Chitkara or visit the Exagen website, you can go to www.exagen.com and your phone number right there on the screen as well. Thank you so much for being with us this morning, and we'll see you back tonight at 10.
Pleasure. Thank you.
All right.